Okay, thank you.
Okay, so let's start with your name again and title.
Okay, Juanita Lawson, CEO of Norwest Community Health Centers.
Okay. Can you talk a little bit about this initiative today and what it, I guess, where it came from and what it means?
Yeah, so Norwest Community Health Centers, we were funded to provide enhanced care services or health services to a number of clinics within our community, and so that's the Port Arthur Health Center, Superior Family Health Organization, and the Aurora Family Clinic. And some of the services that we're able to provide on site for patients of those clinics is mental health services, system navigation, dietary care, health promotion services, and offering as well foot care services here within the Norwest Community Health Centers.
And why do you think these services are so important in Thunder Bay?
Well, we know that there are many individuals who don't have access to care, and so I'll use mental health as an example. That we know that when we can provide timely access to care, that it helps people alleviate some of the stressors that they're under, and will increase their health and well-being in our community. I think dietary care. We know that the issue of chronic disease management and an individual's knowledge about food and how do you choose food and how do you manage your diabetes will be helped with our dietitians and also with access to foot care services, which many individuals need. And then our system navigator, it really is, that role is really important for individuals, specifically regards to how do they access the services that they need, and whether it be around housing or whether they need access to addiction and mental health services or whether they need support around how do you find food and the resources that you need for you and your family to be well.
So when somebody asks their physician for a referral for these services, I guess what's the process after that?
It's pretty simple. Our staff at those sites will receive the referral. It's a little bit different at each clinic in terms of how patients would navigate that, but basically the referral goes in and they would be contacted in a very short period of time to receive those services at that site.
And what are some next steps for the Norwest Community Center with this initiative?
Well, I think one of the things that we're well aware of is Norwest, while we do some great work in this community, one of the things we're hoping is that we can also encourage patients who are using those services at those clinics to also use all the other services that we have available here. Many of our programs, such as our Rapid Access Addiction Medicine Clinic or our community kitchens or our Wellbriety programs or grief and loss groups, patients at those centers will also be provided with information to come here and to use those services. As well, our health promotion in terms of working with clients at Aurora. It's a great example of you've got the clinic within a grocery store that we can do grocery store tours for people who have diabetes and look at health and wellness. So we'll be looking at how we can continue to do work in this community to enhance people's health and well-being.
Can you talk about the impact then that this is going to have on patients and the people of Thunder Bay in improving their health?
Well, one of the things that, health for all of us is really important, and some of us are blessed in different ways. We know that there are many individuals who don't have insurance, they don't have health benefits, so their ability to pay or access services because of fee-for-service models is difficult. So we know that this will help individuals. We do know there is a significant amount of pressure in the mental health system with regards to being referred and receiving services in a timely manner, but we also know that continues to be demand in the emergency department for people accessing services there for mental health, where we can provide that service and help people navigate that system.
So this essentially just helps speed up referrals that might otherwise be occurring?
Well, I don't know if I'd say it necessarily, while there will be increased access, I think it also is providing the service that people need at that time.